Both an L405 disc bulge and an L5S1 disc bulge, they can both give symptoms into the leg, down into the leg, into the calf, the heel, and even into the foot. It could be a numbing sensation or a tingling sensation. Oftentimes it can cause trouble with walking, standing, moving around, sitting, and even sleeping. Now in this video, you're going to learn when a disc bulge symptom is getting worse and when it's getting better. It's a very important concept and we're going to talk about it, so follow me in this video. Hi there, I'm Dr. Walter Salubro. I'm a chiropractor in Vaughan, Ontario, Canada. And what this channel is about is to give tips and strategies on how to strengthen and stabilize the back. So if you're struggling with your back and you're looking to get back to a normal life and you want to learn how to bend, move, and lift easier without pain and limitation, then subscribe right now by clicking that red button below and tap on the notification bell. Like this, you don't miss out on great new content that I give on a regular basis. So if you followed any of my videos already, you'll know that a disc bulge injury in the lower back, like L405 and L5S1, it can cause a tremendous amount of pain, disability, and limitations, not just by causing local back pain, but also leg pain. So one of the things I look for when someone's under care in my office is to measure how things are changing and improving. So we have a lot of different ways we measure that, but from a symptom perspective, there's one specific thing I'm looking for, which I'll talk about in this video, that you need to know about. Before I do that, let me just explain a bit about the anatomy of the lower back area so you get an idea of what I'm talking about. So over here, this is anatomy model of the lumbar spine and the pelvis. You're looking at the spine from the front. So again, just the lumbar area. The spine should be straight from the front, and then from the side actually has a nice elliptical curve. The vertebrae are here, and in between are the discs. On the side are the nerves. Now the nerves that go into the leg come from L405. So let's turn it around. Here's the back side. So L405, right in there, L4, L5, and also the sacral nerves. Okay, so let me go in there so you can see that. The sacral nerves in here, they go into the leg. So they form the sciatic nerve and then branches out into different nerves that go into the bottom of the leg and foot. Let me show you also what I'm talking about in this poster right here. So follow me right now. So this is a spinal chart poster, and you'll see again the lower lumbar area. So that's that spot right there. Lower lumbar area, the nerves, L405, L5S1 area, those and the sacral nerves, they form the sciatic nerve, and then it branches out into two nerves that go into the calf and into the foot. So when a disc injury is irritating a nerve, that irritation, that pain can shoot down into the leg, into the foot. That's called peripheralization. When there's peripheralization of symptoms associated with a disc injury, that means that the problem is progressing and getting worse. We don't want to see that, okay? It's debilitating, it's very painful, causes a lot of limitations. When there's peripheralization of symptoms, down the glutes, thigh, leg to the foot, that means it's a progressively worsening problem. Other signs of peripheralization can be shrinking of the muscles, like around the calf, the girth of the muscles, as well as the girth of the thigh. I've seen that with our patients. That means that the nerves are literally choking off and those muscles are shrinking and dying. Other aspects of peripheralization can be alterations in deep tendon reflexes, which we check for, or diminished light touch sensation, or weakness in the lower extremities like the foot in terms of lifting the foot, or so it's dorsiflexion or plantar flexion, or the big toe. There can be weakness in those areas. So we check for these. Those are all signs of peripheralization. Now, here's the key. This is very, very important. You need to look for this when you're doing therapies or rehab or any type of care for your lower back, for your discs conditions. When the peripheralization is reducing, minimizing, and returning back. So when it's beginning to centralize. So from down the legs, it's moving back up to the lower back region. That's the source and origin of the problem. So watch this. Our back will be here. When symptoms of the lower leg region and the feet begin to centralize towards the source of the problem, that's called centralization. That's a sign of the condition improving. Away from peripheralization towards the source of the problem. It's called centralization. Sometimes during centralization, there's more low back symptoms. During peripheralization, there's less low back symptoms and more leg symptoms. But during centralization, during the improving stages, there's more low back symptoms and less leg pain symptoms. And I always tell my patients, I reassure them, you're on the right track. That's a sign of healing. So in this video, plain and simple, I just wanted to give you a distinction of centralization, peripheralization, what it means when a disc bulge is getting worse and progressing, and how you know that the symptoms and conditions improving. As always, when there's these types of degenerative conditions on the spine, it's always very important to get it corrected, get it analyzed properly, get it corrected. So if you're ever looking for corrective care chiropractor, which is the kind of work that I do in my office, let me know. Just leave a comment below and I'll help you and direct you towards a directory of corrective care trained and certified docs around the United States and Canada and other parts of the world, and hopefully you can find one in your area. I don't mind doing that for you. Let me know what you thought about this video. Comment below. Don't forget to subscribe and click that notification bell. As well, if you're looking for more exercises to do for your lower back and you haven't seen these yet, check out this video right here that has 4 great exercises for the lower back for L405 disc bulge. Check that out right now.